My teeth feel really strong, like I have no loose teeth, no nothing. I feel like my old self, like I used to be. I feel like I'm revived and fresh. So I want to get out there and start living again. Pulled away from socialising a lot because of my appearances. Chewing, eating any hard solid foods like meat, steaks, it's always painful. My name's ERDAL'S. So when I first started having issues, it was about 2.5 years ago with my teeth, and gradually over time it just got worse and worse and worse. What I look forward to the most with this procedure is to be able to go out and socialise again and to build my confidence back up again. Just to be myself again like I used to be. Take my wife out and really enjoy a nice dinner where I can smile over the table, not worried about people seeing me that way.
Good morning.
Morning.
How you doing?
I'm good.
Hi.
Yeah.
I'm
That's
Alex.
Alex.
Pleased to meet you.
Sue, my wife.
Sue. How are you feeling this morning?
I'm good, I'm excited.
You excited?
I'm excited, yeah.
Ready
I'm
for it?
Yeah.
How are you feeling? You're a little bit nervous for it? Nervous for it?
Yeah.
Yeah. It's going to be a little bit of a journey. So you will have your surgery today. There's going to be a fair amount of swelling and bruising after the surgery. And then it's just a matter of, it's going to be the recovery time.
Yeah.
Do you have any questions or?
No, I'm looking forward to it. I'm in your hands.
Yeah.
Do your magic and I can be free from this and I can get on with my life. Like.
Well, ready to go?
Okay.
He'll be fine. He'll be good. Yeah, he's going to be a different person. Yeah.
He was in pain for months and he had an accident last 2 years ago. From then it started mostly. Slowly the pain got worse.
Yeah, and he's good with pain, so he kind of didn't say anything for a while, yeah.
He didn't say nothing for the first year.
Once the teeth are out
Yeah.
and the infection is out, he's going to feel a lot better. Okay, we'll get going.
Okay.
Today's the big day. We're going to get on and give him some implants and give him some teeth. More importantly, at the end of today, he's got quite a few issues with his teeth, going from the decay and the gum disease and then the lack of bone. So it all kind of started happening after he had his bike accident, but he doesn't have a lot of bone. So we're going to use the Zygoma technique for him today. He has some infections in his sinuses, which we've managed by removing those bad teeth which are causing the infection. He does have an implant that we're going to remove, which adds a little bit of complexity, but overall should be a reasonably straightforward case. Say 7 days of the week.
Monday, Tuesday, Wednesday.
Does it feel like your speech is better?
Oh, a lot better. I can hear myself talking and it's like back to what my speech was.
Yeah.
Because I couldn't get the S's out, but now it just feels like me. It's like my voice.
As far as the procedure goes, did you feel any pain throughout the procedure or?
No, just a bit of numbness. Basically, not that much pain.
Yeah.
Like I was expecting a lot of pain when I woke up.
Yeah.
But no, it's been no.
Really
no.
good. Okay, well that's great. Okay, well what we're going to do now is we're going to get you to go home, have a bit of a rest. It's been a really long day for you.
Yeah.
And we'll come back tomorrow and put your permanent final teeth in.
Perfect.
All right, does that sound all right?
Yeah.
That's great.
Yeah, thank you.
to you. Yeah.
Hello. How are you? So Erdal hasn't seen his teeth yet. Let's see what they look like.
Okay.
Have a look in a,
Okay.
and you can take the mask off when you're ready.
Okay. Ready?
Yeah.
It's very nice. It feels like the oldest days that he had his teeth.
Yeah, you forgot to send me the picture, but I think we figured it out.
I still got the pictures, but I thought I knew that it's gonna be very nice. His teeth.
Thank you.
What do you think?
Oh, I love
Let's have a look. Big smile. Wow.
it. Yeah.
Yeah.
I can't.
Well done. You
No,
did.
thank you very much.
It was,
Thank you very
it was
much.
a big day for him,
I'm
but
not gonna stop looking at the mirror. I was avoiding mirrors for a long time. Didn't want to look at mirrors for a long time.
well, we're going to go and take a quick X-ray,
Okay.
and then we'll see you back here in 3 weeks. We'll show you how to clean them. But for now, you just use a normal toothbrush. You can't take them out; they're part of you now. So you just use a normal toothbrush to brush them as well as you can. Any other questions for me that you over the next few weeks?
There's no questions, but I just want to thank you.
Yeah.
Thank you, all of you, for giving my husband back.
Thank you.
Thank you.
I haven't seen him smile for a long time.
It makes our day, and he's been a great patient, great sport as well.
Right, you can let go for me now.
Be very much more swollen.
Okay.
Not to be shocked.
Yeah.
It's normal,
Yeah.
and then it's slowly after that will come. Will get better and better. But really, the swelling is worse on day 3 and 4.
Okay.
It's usually it's worse.
Okay.
So, okay.
Great.
Good.
All right,
Perfect.
thank you.
Okay, I'll leave you here.
Thank you very much.
You're
I
welcome.
really
No,
appreciate it.
it's a pleasure.
Really, thank you very much.
Yeah, you're welcome. I will see you in 3 weeks.
Yeah,
time.
definitely. Thank you.
Thank you.
This is a floss. I might take off those glasses
Yes,
for you, so you can have a look at it properly. So the idea behind this floss is it cleans, say your implants are like that on the top jaw, it cleans the area in between the implants, so the undersurface of the bridge. So whenever you eat food is going to get stuck there.
I'm here in my 3-week review. I've just gone through the cleaning process of the showing me how to clean my teeth and how to take care of them, and which has gone down good.
Push this floss down there.
Oh, okay.
Can you see that?
Mm-hmm.
Yeah, and then you just rub across there. So
Ah,
it'll get out all the food debris from down there.
Okay. My family is overwhelmed. I think they're just all really happy at the moment, the way my teeth are. And I think it's brought back the old me as well. I have a bit more confidence. So I'd like to get back out there in social, like going to restaurants and mixing with a lot of people, that to be out there in the public. So I'm not so weary of my teeth anymore. Sometimes I forget that I've got my teeth and I hide my smile, then I remember I've got teeth, so I smile. Yeah, it's been really good. The best moment was when I had the procedure, and then when I first had a look at my teeth the first time, I was amazed that it looks so good. And I think the thing that I was amazed at most and happy with most is it took such a short process to get me to this stage. Like, it's only a few weeks, and I'm so happy with the procedure, the way it went. It wasn't overwhelming. It was quite easy, I found it. The pain after the procedure, I think felt a bit of pain in the first couple of days, but after the 4th, 5th day, the swelling went down, and I was like fine. I returned to work after the 2nd week. Like, I was back at work doing
my normal duties. I was ready to go to work in the first week, they were good, but we kept another week. I get a lot of comments from everybody at work telling me, oh, that's unbelievable, they look really natural and everything, and they're telling me that I look 10 years younger at the moment, so I'm really happy with that. My teeth feel really strong, like I have no loose teeth, no nothing. I feel like my old self, like I used to be. I feel like I'm revived and fresh. So I want to get out there and start living again, because I think that was really bringing me down, the way I looked with no teeth and problems I had eating. So I think I just want to put that all behind me now and get on with living life. Yeah.
What do the kids feel? Because they're the biggest critics, right? The kids tell you exactly how it is. Yeah. What do they say?
The young one, he's 21.
Yeah.
He just keeps looking at me. Like we'll sit on the couch in the lounge room. He just keeps looking at me. And I say, "What are you looking at?" And he'll say, "Dad, you got your teeth. You're smiling again." And so he's really happy. Both the boys are really happy. I really feel like I can crunch into an apple, no problem.